Welcome, everybody. Thank you so much for joining us on this episode of Weekly Dose with Dr. Ude. I have an amazing guest. I'm very excited. So I'm going to be getting right into it. But to get started, I'll start with introductions. For those that don't know me, I'm Dr. Ude. I'm a board-certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a primary care practice, Apple Valley Family Medicine, and an aesthetic practice. And my goal is to have my patients not only feeling good, but looking good. All right. So, what I have for you, I have a treat for you. This is actually my longtime friends. What, since college at least?
Since college, yeah.
College. All right. Let me mute my phone here so we don't get interrupted. There we go. And she has taken time out of her busy schedule to be with us today. So let me give you some information on Dr. Adepoju. She is a board-certified plastic and reconstructive surgeon. She's based in Upstate New York. She works a lot, focuses a lot on breast and body work. She's a wife. She's a mother of 3. And she's an exercise enthusiast. And she's here with us today. So Dr. Adepoju, welcome.
Thank you. Thank you so much, Dr. Ude, for having me. This is really exciting.
So good. All right, guys. So what we're going to be talking about is we're going to be talking about breast reduction. So this will probably be of interest to our female friends that are heavier chested and are looking to consider a breast reduction. Yeah. So Dr. Adepoju, what reasons or what scenarios do patients end up coming to see you?
All right. So a couple of things. So a lot of times patients will come in because they were referred by their doctors because they're having problems, chronic problems such as back pain, shoulder pain, neck pain. Sometimes they have rashes underneath their breasts. They can't exercise because their breasts don't fit. Or they just feel like their breasts are too big and they can't fit into anything that looks good because their breasts, they have to get a much larger size on top than what they would wear on the bottom. And sometimes the other scenario is patients who have chronic pain issues. They'll go to a chronic pain doctor who would then notice, hey, you're kind of heavy chested. This might be contributing to your pain. So then they would refer them to me as well.
Okay, that's perfect. And you know what? You kind of answered my next question, which was symptoms and complaints, and you kind of them out. Yeah. So the other question I get a lot of questions about is, does insurance cover this procedure? Like I literally had somebody ask 2 days ago.
Yeah, so insurance will cover it if you have the correct documentation for the symptoms you're having. So you have to have pain. You have to have large breasts. Obviously, you can't come to me with a C cup and complain that you're having back pain and all that. I mean, it's possible, but I have to take pictures. I have to send the pictures to the insurance company. So it's not just what I say; it also has to match what they're looking at.
So, what size? I'm sorry, so I don't forget. Yeah. Size is big enough as far as for insurance, or
that's a very good question. There is no size that's big enough. So most people just come with their symptoms, and I can usually tell by just looking at them and be like, yeah, those are big, and you might benefit from reduction. But I've had people come to me with a D cup. I've had people come to me with a double G. So it really all depends on what your body type is, what your comfort level is, and what the symptoms are that you're having.
Thank you. So, because this question, so guys, you've heard it. So we have to have documentation.
Correct.
Now, the other thing is, what are the contraindications to, the surgery? Are there any?
So, yes, you have to be healthy. That's the main thing. So if you're not healthy and not able to go through general anesthesia, then that's a contraindication there. You have to have reasonable expectations. So you can't, and I've had situations where patients come to me and they want to go from a double D to a D. Well, that's a lift because as part of the surgery, you also get a breast lift. So it has to make sense from my perspective. It has to make sense from insurance perspective, and it has to make sense for you. So I would have some patients actually will come to me and say they want to go from a G to an A. And I'll be like, that's not a good idea. And I'll explain to them why those are. So you have to be in good health physically and mentally to be able to undergo the procedure and be able to do the post-operative recovery course.
So, and then the other one is, what is the youngest age to qualify to do?
That's a good question. So the youngest I've operated on is probably about 15, but you have to be really careful with the younger patients. You have to make sure that they have been stable. Their breast size has been stable for the last couple of years, at least 18 months. Because if they're still growing and you operate them while they're still growing, well, you might have to go back and do a re-reduction because they're still growing.
Mm-hmm. Okay. And then the other one is breastfeeding. Does this affect the ability to breastfeed?
It can. So a certain amount of women are not able to breastfeed, period. Now, we don't know how many, what the true percentage is. However, after you have breast reduction, you may still be able to breastfeed, but because we've severed a lot of the ductal connections to the nipple, you'll probably have to supplement. So you'll be able to give enough antibodies to the patient, to your to your baby, but you have to supplement.
Gotcha. So it can affect breastfeeding, basically.
It can.
Okay.
And that's something that patients have to be aware of if they're very gung-ho about breastfeeding. I will let them know, why don't you have your kids first, and then come back and we can do the reduction.
Okay. And then the other thing is, what are the expectations recovery for this procedure?
So I tell them that plan to take 4 weeks off. All right. So they need to be able to walk around at home, but not do anything. So I tell them you can supervise other people doing stuff, but you can't do stuff yourself. So basically, I want their elbows by their sides. All right. So whatever they're doing within this range of motion is okay. But they're not washing their hair and, blow drying like this. They're not folding laundry, because all those things pull your elbows away from your sides. And when I make the breast reduction, I make it nice and tight and perky. So if you start moving a lot, one, you may have wound complications, or you may have wider scars than what was intended.
The healing.
So yeah, 4 weeks. And even with patients that think they don't do a lot at work, even if all you're doing is typing and answering phone calls, we oftentimes do a lot more than we think we're doing. So you're reaching to the cabinet, you're pulling this, you're handing paper to somebody. So even in that case, I'll still have them take at least 3 weeks off, because I need them to heal well and heal right the first time.
That is perfect. So Dr. Adepoju, I mean, this is great information. I literally, I was talking to about 2 days ago, so I told them to tune in. So
perfect.
They're going to be listening in. So I'm going to switch gears. And this is a question I always ask all my docs that come on is, why do you do what you do?
I've got that question a lot of times. And the easiest, simplest answer is plastic surgery was the happiest rotation of mine when I was in med school. I just absolutely loved it. I loved going to the OR. I loved going to the clinic, which is extremely important, because in my other rotations, I hated clinic. And this was the only rotation that I would go to clinic and just be there and be happy the whole day. I tell this story to some of my patients. I had a preceptor when I was in med school. And on my birthday that year, I was in his office from 7:30 in the morning until 11 o'clock at night.
What?
And it was the best day ever, because I just absolutely enjoyed I enjoyed every minute of it.
You were meant.
Yeah, I guess so. And I just figured, you know what? I want to be happy. I want to do something that makes me happy, that makes my patients happy. If I can do something that will make them feel better about themselves and enjoy their life to a fuller extent, I'm all for it.
The work is well needed. Absolutely. Yeah. Thank you. So guys, you heard. Thank you, Dr. Adepoju, for giving us such good information.
Thank you.
Guys, we're at the end of it. This is great information. I'm gonna post Dr. Adepoju's information as well with this video. The other thing I always end with is if you're looking for a primary care doc, a caring primary care doc, we're available, and at Apple Valley Family Medicine, we're accepting new patients. Give us a call at 304-350-1087, and then look us up online at www.applevalleyfamilymedicine. Actually, Dr. Adepoju, give
Yes.
us where can people find you? Because I usually ask that. Where can people, so if anybody that wants to connect with you, look for you and learn more about you, where can they find you?
All right. So I work out of UHS. That's my, that's my job. You can find me on Instagram on Dr. Ade. That's Dr_Ife_Ade. And I'm on Facebook as well. So anybody that's in upstate New York that's looking for a plastic surgeon, I can be found on the UHS, which is the United Health Services website.
And I can vouch for her. She's a
Thank you.
We'll chat later, but everybody
Thank you. All right.